This is Vandalia Health Mon Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Vandalia Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. At Vandalia Health, we don't just practice medicine, we care for people like family. Once again, welcome to this edition of Vandalia Health Mon Talk.
And good Monday morning. Welcome to the new week and welcome to the show. I'm Kyle Wiggs. Our guest this morning is Dr. Krystal Atkinson. She's got a long title, Chief Administrative Officer, Vandalia Health Mon Medical Center, also Chief Nursing Executive with Vandalia Health Northern Region. And Krystal, good morning. Thanks for coming on the show.
Good morning, Kyle. Hope you're well this morning.
Yeah, we're well. So we've had you on many times. In fact, we used to do a weekly show back during the pandemic, but I think it's been a while. So catch our listeners up with exactly what your role is with the facility and how long you've been here.
Absolutely. So as you said, I'm the Chief Administrative Officer for Vandalia Health Mon Medical Center. That just means I'm responsible for the day-to-day operations at the medical center campus. In addition to that, I am a nurse. So I am the Chief Nursing Executive for the regional hospitals in the north. So that means that from a nursing perspective, I work with all the Chief Nursing Officers at our 7 locations here in the northern region of Vandalia Health. So always pleased to be able to have an opportunity to talk with you and our listeners. And I've been here, I'm going on my 6th year. I came actually during the pandemic in May of 2020. So I'll take a page from David's book. I like to say that I am a West Virginian by choice as I moved here from Richmond, Virginia.
Okay. So it's you've settled in as part of the family.
Settled in as part of the family, Kyle.
Very good. We've got a new brand to kind of talk about here. There's been some signage changes. There's been some title changes around Mon Health hospitals and the clinics. So I'm going to let you explain why that's going on.
Absolutely. So it really goes back to where we started in September of 2022. So our Mon Health facilities came together and we merged with the 4 CAMC facilities in Charleston to create Vandalia Health. I think that was a fantastic merger with, our president and CEO, David Goldberg, along with Dave Ramsey, who's currently our president and CEO for Vandalia Health and formerly for CAMC. Great opportunity for us to look at where we have strengths as individual systems, and then came together to create a larger system. 2 years ago, we then brought in the Davis Health System in Elkins, which comprises Davis Medical Center, Broadus, and Webster as well. And so now we are 17 hospitals strong and soon to be 18 with Mount Harrison that's being currently under construction in the Bridgeport area.
So the merger's not new. The merger is, a matter of fact, several years old. It's just a matter of everyone coming together and, I guess for lack of a better word, the branding of the umbrella company changing, right?
Absolutely. So looking at where we were from 3 different entities to then coming together, forming one entity, and really what we wanted to do, some of the purpose of our conversations today is to help our patients, our communities have an understanding that what they're seeing every day when they're coming in our facilities, our outpatient clinics, our emergency rooms, etc., there's nothing that's going to change on the inside. What we're looking at is the branding on the outside for everybody to understand that, yes, this is a new hospital system, but you're still going to get that, or healthcare system, you're still going to get that same feel as you had in the past. Yeah,
change for some people can be a little unnerving. So it's good that you come on and others come on and talk about the fact that nothing has changed. The employees are the same. Basically everything is the same with the exception of the name that's going to change.
Absolutely. And I think to add to that, one of the things as we look at from a positive change is just the strength of the organization, is bringing these three systems together. We're now able to provide better access to our patients, our communities, and that's really the goal, is for us to make sure that when they come into any Vandalia Health facility, they're still going to get that same level of care and trust. But now they have the ability, if, for instance, they were skiing and, had an issue in the Elkins area, they can go into Davis Medical Center, right? And so they may see a physician here in Morgantown, but they'll still have that same ability to be able to have their care there and be able to have their records, et cetera. So those are the things that we really want to make sure that our communities have an understanding that the names on the outside of the building are changing. You'll see different colors on the outside of the building, but what's inside is still the same.
So why is it important to bring everyone together under this title just for branding purposes? Why is that important?
Well, I think it's important just from the standpoint of having a oneness, right? So going from the three individual systems to now creating one new system, if you will, it gives us an opportunity to look forward in the future. So taking the best of what we had individually and coming together as one, but again, looking at ourselves from a branding perspective of being able to show our communities that now we have the ability that maybe in one community that previously had limited services, now we have that ability to stretch those services across the enterprise.
So as you mentioned, the Vandalia Health, that banner was created in 2022, and the merger started back then. So in terms of the name change and the branding, is all of this happening at one time?
No, it's actually a smaller rollout. So we actually started with the Davis Health System and started everything on the outside of their buildings. When you drive up, you will see the Vandalia Health branding on all of those buildings. And now we're starting to look at making those changes here in our northern region hospitals, as well as in Charleston. So as you drive, whether in Morgantown or Preston or down in Charleston, you'll start to see some of the changes on the buildings. Patients, as they're getting collateral in the mail, they'll start to see they'll see those branding changes on information that they get. Mm-hmm. So it's a gradual change to be able to start to see that signage.
We are visiting with Dr. Krystal Atkinson, Chief Administrative Officer, Vandalia Health Mon Medical Center, and Chief Nursing Executive, Vandalia Health Northern Region. We're talking about the name change, basically. Mon Health, it's still the great system that you've come to know throughout the decades. It's just going to have a new title with new signage, and we'll continue the conversation about this when we return. Stay with us as the program continues right after this.
Now back to Vandalia Health Mon Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Back on the show, thanks for joining us. Krystal Atkinson, our guest, and we're talking about Vandalia Health. And again, folks around this area of the state are starting to see the new signage going up at Mon Health Hospital and some of the clinics, and we're here to explain why. Well, we talked about that in the first segment, but as we continue on here, Krystal, you've talked a little bit about these facilities coming together. Talk more about how this unified system, now known as Vandalia Health, how that will, moving forward, benefit patients.
Absolutely. So again, this gives us opportunity to just share our specialized expertise across our hospitals. So as we have physicians that today they're going into different areas of our community and serving facilities. If our facilities did not previously have, let's say, cardiology, we have that ability to have cardiology presence in these hospitals where that he didn't have that before. Access is always important to us to make sure that we can bring the access and we can bring the healthcare needs closer to the communities. Again, those advanced services, looking at that ability to be able to streamline referrals for patients, it's always about making it easier for patients to get into our facilities. And then looking at things from an efficiency perspective, we're starting our journey towards coming together on one medical record. It may not sound like a lot, but it's a huge endeavor. And what that does for our patients, it gives our patients the ability to go into any one of our facilities. A provider can pull up their medical records, and they don't have to continue to ask patients a lot of questions about their history. They can pull it right up. So what that does for our patients is it makes the care more efficient for them.
What about your employees? What does this mean for the people who work for you and with you?
Yeah, absolutely. It's a really great opportunity to be able to grow internally. So we have the ability, as being 17 hospitals strong, when there's career opportunities, growth opportunities, they don't have to feel that, oh, well, I work at one facility, there's no opportunity here, I'm just going to have to leave and go outside of the system. We have opportunities for people to grow all the time. And so I'm really excited about that, for our staff. But even if they don't want to leave their facility, they can go to another facility for increased training, education opportunities. And it's really great for us from a recruitment and retention perspective. We can share our best practices across the organizations. So when we look at that from a goal of being the employer of choice, it really helps us in providing that excellent care we strive to give every day.
And with this expansion, your reach not only means West Virginia, but Maryland, Ohio, Pennsylvania, Virginia. So Vandalia Health is now a multi-state system. Why is that important, and what are the advantages there?
Yeah, again, even just going across state lines, it's providing additional access. We have people that work in our facilities now that they don't actually live in West Virginia. They live in Pennsylvania. We've got folks that travel from Maryland. So to know that we have those outreaches for the communities, it gives them the opportunity, and maybe those areas where they may not have had specialty care, and it gives them that connection. Again, trying to provide that access and make sure that all communities get the same level of health care across the board.
So with this rebrand, you also have a new vision statement. So what is that, and what does it mean?
Yeah, what we did is that, our boards from the legacy facilities came together, and they really took some of the best pieces of our existing missions and our vision and values and came together and really focusing on that compassionate patient-centered care, wanting to be that employer of choice. We want to make sure that we're leading in education and training for our physicians as well as our staff, and then understanding that everything that we're doing from a transition perspective really supports these goals.
So it's a new brand, it's a new vision statement. Talk about the future. Get into that. Vandalia Health has expanded. It continues to grow. What does the future look like?
Absolutely. Again, we want to make sure that we're looking at things very purposefully. We want to look at being, a partner to where we have other healthcare communities within our within the regions, and to be able to best partner, but to make sure that we have that continued growth in our hospitals and our clinics. We're going to continue to make the investment. As I shared, we're building a new hospital in Bridgeport. That'll be Vandalia Health Mon Health, as well as clinic investments. We have a increased clinic space that's being built in Preston, at Preston Memorial Hospital. And so looking at expanding our services, making sure that those services are closer to home, having that strong regional healthcare partnership, looking at innovations and training and education, and just making sure that we're able to have that long-term sustainability and growth in our communities. That's extremely important to us.
Take a moment and discuss a bit the Bridgeport facility and the niche or the need that's going to fill. I know you guys have done wonderful things in Preston County with the facility in Kingwood, the Mon Marion Neighborhood Hospital in Marion County. That was much, much needed. So what about the facility in Bridgeport? What's the timeline for that? And again, what type of niche will it serve once it's completed?
Absolutely. So where we are currently is, as you talked about, Mon Marion, that this hospital in Harrison is going to be a duplicate facility of the Mon Marion facility. So what that looks like currently is an 8-bed emergency department with a triage area as well as a psych area, and then a medical side for an inpatient side for 10 beds. What that allows us to do in that area is to be able to provide some decompression for the area, frankly, and looking at the ability to have an additional ED space, but also if patients need to be kept from an inpatient perspective, they'll have that ability to be able to stay in the hospital, just like Mon Marion. We're going to have MRI services, radiology, CAT scan, lab, all the things that you would see in any inpatient hospital. And then, again, for patients that are in the area, it gives them an opportunity to be able to be seen closer to home. But if they need a higher level of care, then they have the ability to be able to transfer to Morgantown, like for surgery or advanced cardiac care, et cetera. So, again, it gives us the opportunity to have, that immediate urgent care to the facility, but it in a hospital format. We have the luxury of being able to take our time, look at community needs. We've got about 17 acres on that site, so we'll build future building for that hospital based on what the community's needs are. And so, again, that goes to our commitment to make sure that we're providing for our community.
So it's a great concept, and we've seen it in Preston County and Marion County. Some of maybe the outpatient type procedures, people don't have to travel all the way to Morgantown for, make that 2 or 3 hour trip, but they're in the system, so to speak, right? So if they need that next level, they can come to Morgantown.
Exactly. It'll be a seamless transition for the patients.
We've got a couple of minutes left. What final message would you have about this transition? Again, change for some people is difficult at times, but these are all positive changes.
Absolutely. And as I said, it's really looking at us coming together and having our communities have an understanding of, what does this Vandalia Health thing mean, right? We want to have that understanding that although you will see the name changes on your primary care office clinics or your hospital of choice, you're still going to get that same level of attention, that same level of excellent care, that same level of attention, and just having that difference, that different feel that you've always known to love in our legacy hospitals, now having that ability to be able to stretch across the entire state. And as we talked about, too, from an outpatient perspective into 4 other states. So we're really excited to be able to, unveil, if you will, the new name, but really want to make sure that our communities, our patients, their families understand that we're still the same, folks that have been providing care for years.
So is the signage up yet, or will it be soon?
It will be soon. We're doing it in gradual stages. Like I said, in the Elkins area, that signage is complete. And so we'll start to see over the next few months, we'll start to see some of the signage that you've seen and know us for in the green, the shades of green. We'll start to see those come down, and you'll see more of the rhododendron, the pink, and some of the gray and white. You'll see that start to take over. You'll still see the large Vandalia Health sign, but you'll still see our names underneath. So you'll still see, if you come on this campus, you'll see Vandalia Health Mon Medical Center. Again, just making sure that our patients are aware that there's nothing that's changed on the inside. We're just doing some updates on the outside.
Right. So it's still going to be Mon Medical Center, but it's going to be Vandalia Health Mon Medical Center.
Correct.
And the same with Vandalia Health Mon Preston Memorial Hospital in Kingwood, Vandalia Health Mon Marion Neighborhood Hospital in Whitehall, Vandalia Health Mon Stonewall Jackson Memorial Hospital in Westover, and then the new facility that we spoke just a few minutes about in Harrison County, Vandalia Health Mon Harrison Neighborhood Hospital in Bridgeport. Did I forget anything? Did I leave any of them out?
I think you've got all of our legacy Mon facilities, and then we've got Vandalia Health Davis Medical Center, Vandalia Health Broadus Hospital, and Vandalia Health Webster Hospital. So we're, again, excited to be able to share this with our communities and just reassure them that as you open the doors, you're going to still get that same level of excellent care that you're used to.